Good afternoon, everyone, and thanks so much for joining us here on KXAN Live. I'm Will DuPree. Last night, KXAN aired an investigation that looked into an obscure program that provides huge sums of money to nursing homes here in Texas. We really looked into whether the facilities who receive these particular funds are protecting residents. Here's a sneak peek.
Why would quality of care reports designed to protect the elderly in Texas be waived during a pandemic?
You need more of this accountability, not less.
KXAN investigates why millions of dollars went to nursing homes where COVID-19 came and killed.
You have to do your job in order to get paid.
KXAN gets answers on behalf of our most vulnerable.
It's something we will address now as a result of your reporting.
See our full investigation online now at KXAN.com.
Here now to provide a little more information about what her investigation uncovered is investigative reporter Avery Travis. Avery, thank you so much for being here. We really do appreciate you joining us and sharing some more information. And Avery, it appears your microphone might be muted there. Yeah.
A year in, and we're still learning how this work from home thing works. Thank you, Will. No, I was just saying it was a long investigation. We worked on it really starting way back last summer when we learned of the program. So we were glad to finally bring that to people and start to get some answers as the program works and why it works the way it does, and maybe why there should be some more eyeballs on it as well.
Yeah, maybe set the stage for people a little bit. Explain what this program that you found out about and explain in your story exactly is.
So we've talked a lot here at KXAN about the protections that were put in place for some of our most Texans, our seniors who live in nursing homes and assisted living facilities. There's been a lot of focus on how to protect them during the pandemic because so many of these folks were affected by the coronavirus. What we hadn't talked about much was the other aspects of care that a lot of these folks require and need. That's help just moving around sometimes or getting access to medication. So we started hearing about this program called the Quality Incentive Payment Program. It's a program that basically encourages quality care in skilled nursing facilities. It works just like its name. The better quality that these homes provide, the more money they receive. And this money comes from the federal government and then is funneled through the state. So if they meet benchmarks on these quality metrics, things like, how many of the residents
Avery, if you're able to hear me, it appears maybe the internet connection has dropped out a little bit about at your place right now where you're joining us. So we'll see if Avery can join us back here in just a moment and continue her information that she's sharing about the investigation that aired again last night. Avery, it looks like you are back with us now. Things had frozen just a little bit, but thanks for sticking with us. And as everybody knows out there, there are so many issues with remote working, and this is just the reality of the situation.
Thanks you all for your patience. I was telling Will I'm always trying to find the spot in my house with the best Wi-Fi. I know we all have that struggle as we try to stay safe and stay socially distanced these days. I think the last thing you may have heard, or what I hope to get across, is the purpose of this program is to encourage nursing facilities to provide really quality care. And the more they score on these quality metrics, the more money they receive. So it really has some great aspects of the program. We've heard advocates been a lifeline for some nursing homes to survive, especially during this pandemic, and provide that care to their vulnerable residents. What we found, though, was that many of the reporting requirements and the documents they have to fill out in order to meet those check marks and receive that funding, those reporting requirements were waived in light of the pandemic. At the federal level, health officials made the decision to allow these homes to focus on coronavirus preventions. But we had several family members asking us, why is my loved one's home not submitting these other important quality metrics and requirements, things outside of maybe caring for them and protecting them from the virus, but them in other ways. We had a lot of families reach out concerned saying, we don't want the rest of their care, their life, to fall by the wayside as we try fighting off the virus.
That was the big question I had for you, Avery, was during the course of your investigation, did you uncover any evidence in particular about whether there had been anything overlooked during the pandemic that would have normally been reported for a facility that had to receive funds through this program?
Yeah, well, I want to go ahead and point out there was an Inspector General report done at the federal level by the Health and Human Services at the federal level who looked into the efficiency of this program. And they really said the program prior to these reporting requirements being waived, this report said it was not functioning efficiently and encouraging quality. Anecdotally, just from our team's reporting and speaking with families of loved ones in these homes, they've been worried about the quality of the care their loved ones are receiving because a lot of times family members and loved ones provide a really important service. They check their loved ones. Did they receive their medication today? Have they, gotten up and stretched their legs today? I've heard even from nursing facilities themselves, they really partner with the families and friends of these residents. So to not have those family and friends in the walls of these nursing homes has been really difficult this past year. Obviously, visitation's been limited to keep these folks safe, but what you give up is the second set of eyeballs, the other helping hand there, just to make sure that somebody's entire care is being complete and being checked on.
If you all are just joining us, investigative reporter Avery Travis is here to talk about an investigation that she's been working on for quite some time now. It finally came together and was aired for everybody at home who watched on KXAN last night. You can read a lot more information about it on our website. But Avery, one other question you raised in your story was that the federal government has already been looking into this particular program. You all are the latest to join that effort, looking into seeing where this money is being spent. What was the reaction that you got from any of these facilities that participate in that program?
Yeah, we reached out to quite a few of the facilities and sometimes even government entities, county hospital districts who participate and own the license of these nursing homes. We really didn't get a lot of feedback. We really wanted to sit down and kind of hear how the program worked on their end of things. We did speak with the Texas Healthcare Association, who advocates on behalf of these homes. And like I mentioned earlier, they're one of the folks who really say that homes rely on this program. They call it a lifeline to provide funding for the homes that care for most vulnerable. But like you mentioned, Will, that federal Inspector General report pointed out a lot of concerns. And really, I think at the very end of the report just called for more evaluation as to how the program's functioning and using taxpayer dollars. That's something that Representative Lloyd Doggett has said that he's going to look into on the Health and Human Services Committee as a result of our investigation. But his team is now taking a closer look just to see if homes and the entities that own them are using the funds efficiently. A lot of the advocates have told us, and Representative Doggett as well, they just want to make sure that every dollar that could be used to provide a great life for some of our older Texans is being used to do that.
Give people a sense about how much money this particular program provides to facilities all across Texas.
Yeah, we're seeing really millions of dollars a year funneled to various facilities across the state. Keep in mind, there's about 1,200 nursing facilities in Texas. This year, $1.1 billion this fiscal year was funneled from the federal government through the state to the QIPP program. One of our analyses in our investigation showed that of the 10 nursing homes right now with the most COVID-19 cases, all of those had nearly reached $500,000 in payments this year. It is important to note this program is not directly linked to infection control. So that's really what governs protecting folks from the pandemic. But this program does have to do with a lot of aspects of their care. So these advocates are really just calling for that large sum of money, almost $500,000 this fiscal year, to be used to make that.
And Avery, if you can hear me still, it appears that the internet connection maybe has dropped out just a little bit. So we'll wait to see if we can get Avery back here in just a moment on our Zoom call. But once again, if you're just joining us, KXAN investigative team looked into this particular program called the Quality Incentive Payment Program, tracking down where the money is going and about waivers that were issued during the pandemic to provide people care and looking into what this program does. So it appears Avery is back now. Let me pull this back up really quickly one more time. Avery, thank you so much again for sticking with us. And it's okay that the internet's dropping down here and there.
I hope everybody at home understands. I'm sure you guys have been through this. I was telling Will I've had solid internet all day. It's like my router knew this was important. But I'm not sure what you guys last heard. I think the point I was really trying to make there was we are seeing payments of nearly $500,000 to many homes after $1.1 billion was funneled into the program this fiscal year. Many of those homes with those pretty high payments are some of the homes who've seen the most COVID-19 cases. So advocates were telling us they really just want to make sure that that money is being used to protect residents, to ensure they're receiving the best quality care they can. $500,000 can go a long way for some of these residents. I do want to say it is important to make the distinction. This program is not directly related to infection control, which is what has to do with protecting people from coronavirus, from the coronavirus. But still, these families have told us for them, protecting their loved ones and giving them a great life is all in the same, right? They want to see their parents, their grandparents thriving in these homes, and they want to see that money used to do that.
Yes, for sure. And Avery, the investigation doesn't end here for you all.
Yes, we've mentioned that Inspector General report a few times, and you can dive into that in our digital KXAN.com right now. But our producer, David Barrere, and myself have really started digging into specifics in that Inspector General report, really trying to follow these dollar amounts and see what they are being used for. We really want to talk more to facilities who are involved in the program and some of the government entities that own them. So we're going to be following up on this. We really encourage anybody who has a loved one in one of these homes and would like to share their experience and their story to reach out to us as well. You can find our social media and our emails linked in the story as well.
Avery Travis, thank you so much for joining us. And again, we will excuse the internet issues because we have all been there for sure during this time. So we appreciate you and your work and your reporting. And of course, you can track Avery at her social media and follow along with her other investigations. She's done such great work during the pandemic, particularly with nursing homes. So I will ask you all to give her a follow. Avery, thank you again.
Will, thank you so much. And thanks to everybody for hanging. I know the internet can be spotty and tough, but this issue is so important, and we know so many families have been affected. So I appreciate you guys taking a listen.
All right, Avery, thank you so much. And everybody, thank you all for watching. Again, you can read more about Avery's investigation on our website. It's right on our homepage there, KXAN.com. So everybody, thank you again for watching. I'm Will DuPree here in the KXAN live studio. Please be safe, take care, and stay healthy.